day, everyone. We are on the last part of our lecture. So, for today, we're going to discuss your intestinal flukes. So, the first organism that we have is your Fasciolopsis buski. Its common name is your giant intestinal fluke. So, it is the largest and most common intestinal fluke infecting man. It is also the largest trematode that could infect humans. No? So aside from being the largest intestinal fluke, it is also the largest trematode that could infect your man. So it is endemic in Southeast Asian countries. Also in India, China, Pakistan, Bangladesh, Thailand, and Malaysia. So risk factors include poverty and unhygienic social-cultural practices, no? That's because the reservoir of your Fasciolopsis buski are your pigs. So in countries where there is practice of open pig farms, no, it is a very big risk factor for acquiring Fasciolopsis buski. So the egg is large, measuring 130 by 140, 130 to 140 micra by 80 to 85 micra. It is oval in shape, brown, and bile stained. Bile stained because it is found in the intestine, no, where bile is released. So it is operculated and not embryonated when laid. So if you could remember from our discussion with your fasciola, no, the eggs of your Fasciolopsis buski are indistinguishable from that of your Fasciola species. So to compare the adult worms of your Fasciola versus your Fasciolopsis buski, so first is your Fasciolopsis buski does not possess a cephalic cone. If you could remember, the adults of your Fasciola species possess a cephalic cone. But if you could notice here on the adult worm of your Fasciolopsis buski, there is no cephalic cone present. Next is the suckers of your Fasciola are near each other, no? Are separated compared to those of your Fasciolopsis buski, which is near each other. So the habitat of your Fasciolopsis buski is in the small intestine, no? Specifically in the duodenum and your jejunum. So the first intermediate host, like all other trematodes, is your snail, specifically that of the genus Segmentina. So the second intermediate host is your aquatic plants, and the definitive host is your humans or pigs, with pigs serving as your reservoir. So the mode of transmission is the ingestion of your undercooked aquatic plants infected, no, or encysted with the Metacercariae. So the life cycle begins with your unembryonated egg that is found in the feces either of your pigs or your humans. No, the embryonated egg is released. No, for example, when it comes in contact with fresh water, the Miracidia hatches, no, and looks for the snail. The same with your other trematodes. It undergoes the sporocyst stage, followed by the first and second generation radiae, and finally the Cercariae is released from the snail, no? And then once the Cercariae is released from the snail, it exists, no, in your aquatic plants. So usually no, like the lotus roots for the aquatic plants in your water chestnuts. So kani sila ang usual nga secondary or second intermediate host for your Fasciolopsis. So man becomes infected if they ingest, no, the undercooked water plants encysted with the Metacercariae. So once ingested, the Metacercariae exists in your duodenum, no? And then from there, dira na sad mo mature ang adult worm in the small intestine, releasing the ova in the feces of your primary host. So pathogenesis is mainly due to traumatic and obstructive damage to the intestine. So light infections of your fasciolopsiasis is asymptomatic. No, could either be local inflammation, ulcerations, and there is presence of mucus and blood in your stool. So during severe infections, there is partial obstruction of the intestinal tract. So if daghan na kaayo ang adult worms in your small intestine, of course, there is obstruction of the intestinal tract. There is also malabsorption. So what happens during malabsorption? Remember that the lining, the cells lining your small intestine, they possess a villi, diba? They have a villi. Unsay purpose? What's the purpose of this villi? This villi is responsible for the absorption of your nutrients. So basically, they absorb the nutrients sa inyong mga ginakaon. But what happens is, if the adult worm attaches, unsay lang ginagamit pang attach, diba? That's their ventral suckers, so once, diba, sucker man siya, so it creates a suction, so once the adult worm attaches to the lining of your intestine, mga matay, this villi becomes flattened or it gets destroyed. So of course, diba, fasciolopsiasis is caused by mechanical damage, and obstruction. So imagine if nakaharang diri ang adult worm, in the lining of your intestine, matabunan niya ang villi, and then the ventral suckers also cause damage to the villi. So eventually, it would lead to the destruction of the villi of your intestine. And then if wala na villi, there is no absorption, which leads to your malabsorption. There is also presence of protein losing enteropathies when you have fasciolopsiasis. So aside from causing damage to the villi, eventually, the constant sucking pressure of the ventral sucker or the acetabulum of your adult worm, eventually it will cause an ulceration. So meaning, with an ulceration, so magka-ulcer ang patient. So unsa pasagutan na eventually magkaroon og, from the constant pressure of the sucking the acetabulum, magkaroon og ulcer. So meaning mabangag ang lining of your intestine. So unsay mahitabo, for example, these are the blood vessels lining your intestine. Unsa ang naa sa imong blood vessel? Diba the most abundant protein in your blood, in your body, is albumin, because albumin circulates through your blood, diba? So what happens is, since naa kay albumin, diba, from the blood, and then naanay ulceration in your intestine, what happens is albumin in the blood, diba, kay mo bleed man jud na if na ulcer, kay bangag man na in your stomach, so mo bleed into the intestine. So what happens is you lose albumin, and albumin ang pinaka-abundant na protein in your body. So you lose albumin via the ulcer, which is ma-release nimo through your stool. That is why there is protein losing enteropathy in your fasciolopsiasis infection. And also the stool in your if you have fasciolopsiasis is yellowish green na stool. There is also marked eosinophilia and leukocytosis in your blood. So meaning, in your complete blood count, increase ang total WBC count, and increased ang, specifically sa differential, increased ang eosinophil count in your peripheral blood. So diagnosis is via stool examination, because again, asa makitaan ang fasciolopsis, it's located in your small intestine. So detection of the eggs gives a probable diagnosis. Nga probable lang, remember, indistinguishable ang egg of your fasciolopsis from that of your fasciola. So demonstration of the egg in the stool, you cannot actually identify kung from which specific genus. So sedimentation methods could be used to demonstrate the eggs if there is a low worm burden. Definitive diagnosis is of course to detect the adult worm. So you have to detect the adult worm and confirm if it is Fasciola or Fasciolopsis. How do you do that again? Si Fasciola na ay cephalic cone, si Fasciolopsis walay cephalic cone. The same with most of your other trematodes. Treatment of choice is your Praziquantel. Next, we have our Echinostoma ilocanum, or also known in its common name as Garrison's fluke. So the first case was reported actually here, in the Philippines, specifically in the Bilibid prison. So distribution-wise, mainly reported from China, Indonesia, Thailand, Taiwan, and the Philippines. Next, we have our A. malayanum, or your Malayan fluke. So characterized by the presence of collar of spines. So the same siya, actually tanan echinostomid worms. The same with your echinostoma na ay collar of spines ang adult worm near their anterior sucker. So it is similar, So similar siya to E. ilocanum, and distribution wise present siya in Southeast Asia and East Asian countries. So comparison of your E. ilocanum and A. malayanum eggs, so they are almost the same and they are indistinguishable. The only difference lang is that the egg of your E. ilocanum, the color is straw, light yellow, while your A. malayanum is golden brown. But the eggs of all of your echinostomid worms is indistinguishable from your Fasciola, your Fasciolopsis, and your Gastrodiscoides. So meaning if you see an ova, kaya dili mo siya ma-distinguish unless you actually demonstrate the adult worm. So here is the adult worm, of your E. ilocanum and your A. malayanum. So ang difference nila is ang pinaka-big jud, the same sila on the anterior end surrounding your feeding na sucker, is na ay crown of thorns, So meaning sa nakita ninyo na ay mga tunok-tunok near their mouth. But the difference between your E. ilocanum and A. malayanum is that si E. ilocanum is tapered. When we say tapered, nipis or panipis. So if you could see the adult worm of your E. ilocanum, it's actually tapered compared to the rounded posterior end of your A. malayanum. So mas rounded, mas oblong si A. malayanum compared to your E. ilocanum. So the same sila, the habitat of your echinostomid worms, the same in the small intestine. The first intermediate host are your snails, So actually for the first and second intermediate host, your echinostomid worms are not picky, They're dili sila selective into what genus, pero commonly pond snails, Pond snails. So kanang snails na makita nimo sa ponds, like specifically in the Philippines, like your kuhol. So the first intermediate host is a snail. The second intermediate host is also a snail. Sometimes even pwede the same na species of snail. So dili selective ang ganyang echinostomid worms when it comes to choosing its intermediate hosts. The definitive host is man. So mode of transmission is ingestion of raw or undercooked snails, infected with the Metacercariae. So Metacercariae is the infective stage for your man, for your echinostomid worms. So the same with most trematodes, an embryonated egg is released in feces. When it comes in contact with fresh waters, it becomes embryonated to release the miracidia. The miracidia penetrates the first intermediate host, which is your snail. It undergoes the sporocyst stage, followed by the first and second generation Deridiae, and finally releases the Cercariae in the water. So the Cercariae infects the second intermediate host, which is another snail, but pwede sad tadpoles of your frog, or pwede sad kanang mga clams and mussels, So kanang mga basically mga shellfish pwede sad nila ma-infect. So once other animals, animals that eat snails or frogs or humans, pag muita sa second intermediate host na wala gi-cook properly, that is when we become infected. So excision happens in the duodenum, no, of your small intestine, and then finally the adult worm is located still in your small intestine. So echinostomiasis, no, during heavy infection, almost the same lang ang pathogenesis sa tanang sa tanang intestinal flukes. So inflammation at the site of attachment sa imuhang adult worm. So kung asa na part ni attach ang adult worm of your echinostoma, of course na ay inflammation because of the attachment using the ventral suckers. The same also, the action of the ventral sucker causes ulceration, and then there is diarrhea. If severe ang ulcer, pwede siya mag-produce of blood, no? So sometimes na ay bloody stool or bloody na ulcer. There is also abdominal pain, of course, kaya naaman sa imong abdominal area ang imong small intestine. General intoxication, so pwede sad ka ma-intoxicate because of the absorption of the metabolites of your adult worm. So unsay pasabot ani, basically asa sila nakapuyo sa intestine, diba? So unsa may trabaho sa intestine, take absorb, diba? Og mga sa mga imong ginapangkaon. So basically dira nagpuyo ang adult worm, diba? And the adult worm feeds sad, no, kung unsa. So basically pag mag-release sila og waste, no, so basically toxins man ni. So possible na ma-absorb siya sa imuhang small intestine, leading to intoxication. Kaya na-absorb nimo ang toxins, no, ang waste products of your echinostoma adult worm. So for the laboratory diagnosis, stool examination gihapon, the eggs are smaller than that of Fasciola species and your Fasciolopsis species, but appearance-wise, they are indistinguishable. So treatment of choice is your praziquantel still, no? Next is your Heterophis or its common name is your von Siebold's fluke. So it is one of the smallest, no, trematode. So isa sa pinakagamay, and it is actually the smallest trematode that could infect men. So siya ang pinakagamay sa trematode that could infect men, no? So geographical distribution reported mainly from China, Egypt, India, Japan, Korea, and Sudan. So the ova, no, it's ovoid shape and old-fashioned light bulb appearance. Familiar, ngano familiar ang old-fashioned light bulb? It's because the eggs of your Heterophis is indistinguishable from that of Clonorchis and your Opis Torquis species. Di ba remember, they are also described as old-fashioned light bulb. So the same with your other trematodes, with your other hermaphroditic trematodes, the eggs are operculated and embryonated when laid. So if you could remember, Heterophis is the only trematode with 3 suckers, no? Diba usually all others narrate to oral and the ventral sucker, but your Heterophis has 3 because it has a genital sucker, or also known as your gonoptil. So basically they use the genital sucker, no, during copulation. Sir, abi na ko, hermaphroditic sila. So meaning capable sila of self-embryonation or self-fertilization. Yes, capable ang Heterophis of, no, kana self-fertilization, but they prefer copulation gyapon. They prefer copulation over self-embryonation. But if wala couple, kaya rasad nila mag self-fertilize, no? So the habitat is the jejunum and the upper ileum of your small intestine. So the first intermediate host is still a snail, no? The same with all your trematodes, specifically of the genus Pironella and your Ceritidea. So the second intermediate host are your brackish water fishes, no? Like your Mugil capito or your tilapia, no? So pwede sa tilapia ang second intermediate host of your Heterophis. So definitive host is man and other mammals that eat fish. So mode of transmission is ingestion of raw and undercooked fish infected with the metacercariae. So life cycle begins, no, the same lang. The eggs are released in the feces, no? And then from the feces, dili siya mag-release og miracidium. So ang snail ang mo ingest sa ova, no, and then within the snail dira mo hatch ang miracidia, which becomes a sporocyst, first and second generation radiae, and finally a cercariae. So the cercariae is released, no, free swimming in the water, and it finds the second intermediate host, no, na fish, and then within the fish, under the scales or the flesh of the fish, dira mag-encysst ang cercariae. So the other mammals, no, and humans become infected if we eat the raw or undercooked na fish that is encysted with the metacercariae, no. So the metacercariae kay asa siya mag-exist sa imuhang small intestine gyapon, and then eventually dira are sad sa small intestine mo mature ang adult worm. So light infection of your heterophyes is asymptomatic. If heavy, there is mucus diarrhea. Unsay pasabot na ay mucus in your stool. The same with your other intestinal trematodes. There is intestinal ulceration and abdominal pain. So laboratory diagnosis is via stool microscopy, but the ova is indistinguishable from your Clonorchis and Opisthorchis. So ma-distinguish lang ang infection if there is demonstration of the adult worm. So the same with other trematodes, treatment of choice is praziquantel. Next is your Metagonymous yokogawai or your Yokogawa fluke. It is one of the smallest trematodes. So slightly larger lang siya than your heterophyes. Distribution mostly in China, Japan, Indonesia, Israel, and Taiwan. So the egg is similar to heterophyes. The difference lang is in the adult stage, there is no genital sucker. So kanang sila with your heterophyes, except there are only two suckers, no, the oral and the ventral sucker, and then wala na genital sucker. So life cycle similar to heterophyes. The difference lang is the first intermediate host is your Semi-Sulcospira na snails. Clinical features, diagnosis, and treatment is similar also to your heterophyes. So the same life cycle lang, no, on sa difference ang genus of your first intermediate host, and for the adult worm there are only two suckers present. Next is your Watsonius watsoni or your Watson's fluke. Primarily a parasite of monkeys, and human infections is rare, no? So few cases reported in the West Indies and the African countries. So the same with other nematodes, the egg is operculated. What's unique lang is the ventral sucker is located posteriorly. Diba usually naara in the anterior third ang duha ka sucker, but for your Watsonius, it's located posteriorly in the adult worm. So life cycle is not completely known. The infective stage to your definitive host is the ingestion of water plants infected with the Metacercariae. So clinical features is similar to your Gastrodiscoides hominis. So your Gastrodiscoides hominis is known as your colon fluke and is the only trematode that could be found in your large intestine, no? So the rest, asa to sila, naa sa small intestine. The only one na naa sa large intestine is your Gastrodiscoides hominis. So mainly found in India, China, and Vietnam, and recently there are also cases in Africa. So the same, no, all of your trematode eggs are operculated, except lang that of your schistosoma. So the eggs are indistinguishable from your Fasciola, Fasciolopsis, and your Echinostoma na eggs. So it is, the adult worm is piriform. So when we say piriform, it is pear-shaped, no? Kanang fruit na pear. So it is pear-shaped. So the anterior end is conical, murag cone, and the posterior end is hemispherical. So the same, no? Ang oral sucker is anteriorly located, and the ventral sucker is posteriorly located. So habitat is in the cecum and the ascending colon of your large intestine. Life cycle is similar to your Fasciolopsis buski, except the first intermediate host is that of your Helicorbis na genus of snails. So light infection is asymptomatic. During heavy infection, there is mucous diarrhea and other intestinal symptoms. So laboratory diagnosis is via stool, microscopy, and treatment of choice is praziquantel. So there is only one organism na under your lung fluke, and that is your Paragonimus westermani, also known as your oriental lung fluke. So among the species of your Paragonimus westermani is the most important because it causes endemic hemoptysis in man. So what's hemoptysis gani? It's your blood in your sputum. So meaning muubo ka og dugo, blood in your sputum. So geographical distribution, it's found in the Far East, particularly in Korea, Japan, Taiwan, China, and the Philippines. So the egg, the same with every other operculated, the color is golden brown and it is not embryonated when laid. So the adult worm is described to be coffee bean appearance, no? So meaning mura daw siya og coffee bean. So what is that? Unsa man na siya? It's oval with broader anterior. So mas dako siya sa taas niya nga portion. If manotice ninyo, mas dako ni na portion compared to this. So mura daw siya og coffee bean kung tan-awon. The oral sucker is anteriorly located and the ventral sucker is medially. So naa diri sa tunga ang yahang ventral sucker. So the tegument is covered in spines. If no? So meaning ang skin sa imuhang Paragonimus is naay murag mga tunok-tunok, no? So its habitat, it's located in the parenchyma of your lungs. The first intermediate host, the same with other trematodes, snail gyapon of your Semicercospira or your Grottiana genus. So the second intermediate host could be crab or crayfish, of your, specifically for the crabs, your Sunda talfosa filipina. So kanya siya ni gawas ni sa ako ang board exam as a question. The second intermediate host of your Paragonimus westermani. So the definitive host is either man, that is dogs, or cats. So mode of transmission is ingestion of raw or undercooked crab infected with the metacercardia. So life cycle and embryonated eggs is released in fresh water. Then once ma-release siya sa water, it becomes embryonated, and then the residia hatches from the egg, no? So it locates the first intermediate host, which is your snail. Same lang, it becomes a sporocyst, followed by the first and second generation radiae, and it releases the cercariae. Ang cercariae ang mo look for sa imuhang second intermediate host, which could either be your crayfish or your crab, and then tito siya mahimong metacercariae. So once ma-ingest sa human ang encysted metacercariae, in its life cycle, no, it exists in the duodenum. So existation happens in the duodenum, and then once mo exist na siya dito, from the duodenum it travels upwards, no. So it exits through your peritoneal cavity, no, and then penetrate niya ang liver, and then up until maabot siya sa imuhang lungs. That is why mas common ang infection, mas common ang inyong Paragonimus westermani infection sa right lung. Kay mo siya ang pinakaduol sad, no? Pinakaduol na lung to your duodenum compared to your left lung. So there is abdominal tenderness, nausea, and vomiting. Ano naamay ko tenderness in your abdomen, of course, kay dira man magsugod ang migration of the metacercariae from the intestinal wall up your abdominal cavity paabot sa lungs. And then finally, once maabot na siya sa inyong lungs, dire na mo develop og pulmonary paragonimiasis. So unsa man ang pulmonary paragonimiasis na ay granuloma formation, no? So common kayo ang granuloma formation for your trematodes, specific lang for your Paragonimus. Asa ang granuloma formation, of course, naa sa lung. And then, the granuloma is eosinophilic. So, unsay pasabot, di ba granuloma formation, if kani ang adult worm, SE, surround siya sa imuhang white blood cells. So specifically, the granuloma formation is made up of eosinophils, no? So eosinophils ang ni surround sa imuhang paragonymous na adult worm. So once na surround na nila, mo try na sila, mo insist na sila, no? So mugahi ang mga WBC trying to contain the organism. And then there is also fibrotic cysts or capsules. So the worms are surrounded by capsules, no? Commonly in the right lung. Ngano gani right lung kaya siya ang mas duol sa path of migration. So within this cysts, no? Within that cysts, kaya na ay blood mixed with purulent fluid. Ngano, diba? Nag-granuloma formation, mugahi man na, so mahimong cyst. So what happens to white blood cells after they die? Diba, mahimo silang pus or nana, no? So maong purulent ang fluid. And then within that cyst, naadira makitaan ang adult flukes and ang egg. So what happens is, once mabuak na ning cyst or the granuloma, no, ma-expectorate nimo siya sa imong sputum. So meaning, within your sputum, na ay dugo, maong na ay hemoptysis, and then naa sa dira ang eggs, no? So usually the sputum of people na infected with paragonimiasis is speckled daw with brown, no? So kanang brown yung makita nimo sa ilang sputum, that's actually the paragonymous na egg. So the fibrotic cyst capsules, no, appear only if moderate to heavy na ang infection. So symptoms, productive cough kaya na ay phlegma, so na ay sputum with brownish tinge sputum. Nano brown siya? Brown kaya because of course na ay dugo, and then naasad ang ova sa imuhang paragonymous, and then offensive fishy odor. So baho siya na phlegm. So there's frank hemoptysis, muubo ka og dugo, and in your peripheral blood mo increase sad ang eosinophil count. So during the chronic stages, no, if wala na treat, dugay ng infection, there is bronchitis. Bronchitis is the inflammation of your bronchi. There is bronchiectasis and so many dilation. So meaning ni dilate ang imuhang bronchi, and there is also pneumonia that all in all that leads to lung abscess, no? So naanay formation na dugo nagnana na ang imuhang lungs. Possible sad na naay extrapulmonary paragonimiasis. So what happens is, after nag-exist ang worm, no, ang metacercaria, possible nga masaag siya, no? So wala siya nakabot sa lungs, naabot siya sa imuhang lain organ. So possible na ma-stuck siya sa liver, naa siya sa spleen, or maabot siya sa brain. So once maabot siya sa brain, this is the most severe form of your paragonimiasis, known as your cerebral paragonimiasis. So instead na sa lung siya mo encapsulate, mahimong cyst, dito siya mo insist sa parenchyma of your brain. Now once mo insist siya dito, mukha siya og fever, headache, vomiting, motor weakness, so meaning maluya ka, or eventually makalead siya to epilepsy, depende kung asa siya na part nag-insist. So possible sa cutaneous paragonimiasis, maabot siya sa imuhang skin, no? So it is tender and vary from millimeters to up to 10 centimeters kung sa imong skin siya mag-insist. So laboratory diagnosis, specimen of choice is your sputum, kaya asa man makita ng adult worm, it's found in your lungs, no? So the specimen of choice is your early morning sputum, usually 7 consecutive days. So 7 days ka sigig test sa sputum sa patient. So every day kailangan mag-submit si patient og egg. Pwede sad siya if gamay ra, if wala kay makita but you really suspect, pwede sad ka mag formalin ether concentration techniques, and then if pwede sad nimo i-liquefy ang sputum gamit ang sodium hydroxide, no, para tunawon ang phlegma, ang mabilin na lang kay ang ova, no, o pwede sad i-stain ang sputum. Stool microscopy is done in children if lisod pa o buhon ang bata. Ngano pwede man stool microscopy if ang adult worm is makitaan sa lungs? So what happens is, usually if mo expectorate, mo ubo na ay phlegma, wala giluwa, And then naman siya tendency no ang humans to swallow the sputum instead. So mao na the eggs could still be demonstrated sa stool, especially for those hilig motulon og phlegma. So serology could be used no to detect antibodies, to detect antigens. So almost the same lang no with your other trematodes no. Pwede mo gamit og complement fixation, indirect heme agglutination, ELISA, Western blot no, all those to detect antibodies and antigen. So other test, if magpa-complete blood count, there is peripheral eosinophilia. So pasabot sa imong complete blood count, taas ang eosinophil count. Pwede mag-MRI and CT scan no, to demonstrate the encystation kung nasa outside of your lungs nag-form og cyst ang adult worm. So pwede ka mag-use og MRI and CT scan and sa chest x-ray also to demonstrate the pulmonary lesion. So sa CNS, if ipa-imaging daw nimo, kay makita nimo ang unsa pag-cyst sa adult worm. So treatment is the same with your other trematodes lang no, praziquantel gyapon. So if you have questions, don't be afraid to ask. So here are your references. It's your essentials, your panikers, and your Belisario.